We try to start working about safety because we have some feedback from the field about reports of adverse reactions following the injection. Those adverse reactions were, in some cases, swelling, lumps, maybe in the neck or in the application site, anaphylaxis, and in some cases, mortality. Based on that, we try to review what's happened with our vaccine and with the other PCV2 vaccines in the market. When, with this proposal, we defined the next study. This study was developed in commercial situations, and in this case, we have pigs injected in the right side of the neck with one of the three treatments. It means Ingelvac CircoFLEX in one case, in other case, 4-dose vaccine PCV2 one-dose vaccine, and in the last case, Ingelvac PCV2 vaccine. How we apply the vaccines? We apply the vaccines using the label manufacturer's recommendation. In the left side of the neck, we use sterile saline water as a control in each one of the pigs. In this table, we try to summarize our trial. As you can see, 3 different groups. You can see 3 different vaccines: Ingelvac vaccine, Ingelvac CircoFLEX, and 2 vaccine PCV2 one-dose. In the next part of the table, we can see how many milliliters, the volume that we administer to the pigs, based in the manufacturer's recommendations, 2 ml 2 times in the case of Ingelvac vaccine, 1 ml, 1 case, just 1 shot in the case of our vaccine, and 2 ml, 1 occasion in the case of the 4-dose vaccine. As I described before, all the pigs received the intramuscular vaccination in the right side of the neck, and in the left side of the neck they received intramuscular saline sterile solution. The vaccinate date in the case of Ingelvac at 0 and 21 days of our treatment. It means pigs of 3 weeks of age received the first vaccination at 3 weeks of age and the second vaccination at 6 weeks of age. In our case, in the case of CircoFLEX at 3 weeks of age, 0 is the day of the treatment, that we start the treatment, and in the case of subvaccine PCV2, 0 is the same, the date of the start the treatment, 3 weeks of age. Finally, we got to do the euthanasia and review the lesions in the injection site at 35 days after the day 0 in the case of Ingelvac, 14 days in the case of the 2 vaccines of 1 dose. I tried to summarize the trial with this slide. Then again, the pigs was euthanized 14 days following the final injection, and the tissue sections were harvested for histopathology. 14 days again after the first injection for 1-dose vaccine, and 35 days after the first injection for the 2-dose vaccine. We did the scoring, and one pathologist, outside pathologist, was blinded to all the treatment. All the pathology review and all the pathology studies was held by Dr. Ken Schwartz for Iowa State University. Dr. Schwartz has a lot of experience with numerous licensing studies at this point. I don't like to take a lot of time describing. That was the scoring process that Dr. Schwartz developed for this study. In this case, we have 5 different scores, 0 to 5, and we have 5 different points of review: the muscle, the connective tissue, the dermis, the lymph nodes if they are present in the tissue, and fibrosis. You can see that the score for 0 or related to 0 is when Dr. Schwartz didn't found any lesions in the tissue. And the major score is for 5. When they found some necrosis, it means part of the tissue was died. Go to the findings. Ingelvac CircoFLEX was not different than saline in either key score. It means in connective tissue and the muscle. Both Interbed and 4-dose vaccine were significantly higher in vaccine than saline injections. We can see another findings. Ingelvac CircoFLEX had significantly lower scores than other PCV2 vaccines in both muscle and connective tissues. No lesions in lymph nodes, nor fibrosis or connective tissue. In this table, we can observe, in the case of the connective tissue, the left side of the neck in the pigs vaccinated with CircoFLEX. This is the right side of the left when the pigs received the vaccine, and this is related with the left side of the neck when the pig that we name control, the pig received saline solution. You can see that in this case, in the case of connective tissue, we don't found any statistical significant differences between these two groups. But in the case of the Interbed and 4-dose vaccine, we found statistical significant differences in the case of the connective tissue. Another point that we need to validate is the big spread of the big variation in the lesions that we observe in that specific tissue. What's happened in the muscle? The same trend. What does mean? No differences in the ejection site in the muscle between the control and CircoFLEX, and significant differences in the muscle in 4-dose product and the Interbed product. Yeah. In summary, in the case of safety, we can say that Ingelvac CircoFLEX provides rapid onset of 14 days and long 4-month duration of protective immunity with simple 1 ml intramuscular injection. The vaccine is safe and is not reactive. Yeah. Then again, like summary, three different groups, and in the case of CircoFLEX, a safe and not reactive vaccine. This is the first point when I need to take decisions of what kind of vaccine use. The first thing that I need to have in mind is that I need a safe product, a product that don't cause damage to my pigs. Based on that, I go for the next step. What's happened? Okay, I know that I have a safe product. What's happened with the efficacy? I just want to remind you about Ingelvac CircoFLEX. Ingelvac CircoFLEX is a suspension for injection. We use 1 dose of 1 ml and contains PCV2 2-ORF protein express. Yeah, it's an inactivated vaccine and is produced in a baculovirus production system and is inactivated. And at the end, we add an adjuvant. We recommend for the vaccination of piglets at 3 weeks of age, and we recommend an intramuscular application, 1 shot of 1 ml, once in the life of the pig. Really simplistic, really nice and easy to do in the field. When we talk about clinical presentations, when I talk about clinical presentations, I refer to that. Clinical, our definition of clinical is when we have sick piglets in the barn. Those sick piglets need to have the symptoms described for PCVAD. It means wasting, it means loss of weight, it means diarrhea, it means respiratory problems, like in this picture. This is a really nice image of a clinical symptom. Diarrhea, wasting pigs, and this kind of guys in the barn. What's happened when we use the vaccine under these kind of situations in the field? In this case, we have an experience of a 1,250 sow herd with one-side nursery and off-site finishing units located in Missouri. The system is Pierce and Mycoplasma negative. The PCVID losses occur exclusively in the finishing units, with the onset of clinical expression starting at 10 to 11 weeks of age, and with a peak of mortality at 14 weeks of age. Okay? Then the disease starts at 10 weeks of age in the finishing unit, and we have the peak at 14 weeks of age. The mortality rate in finishing has been as high as 15% for the last months. No reproductive or nursery problems have been reported. 15% under my consideration is a high level, based that we are talking about a Pierce and Mycoplasma negative farm. The piglets at 10 to 11 weeks of age develop the clinical symptoms related with PCVID, as you saw in the picture. This is the study design that we used. The individual pig was the experimental unit, as you can see in the picture. Each pig in the trial was tagged, has a number, and was sampled and weighted in an individual base. We have three different groups, with one group of pigs vaccinated at 3 weeks of age, a second group of pigs vaccinated at 6 weeks of age, and a non-control group. Those are the numbers of pigs in each one of the groups. We try to randomize by pen. As I told before, we individually tag the piglets, and we use 2 weekly production groups in the farm, Group 1 and Group 2, as we define. Talking about our results under this protocol in this experience. Non-vaccinated control pigs began to show clinical signs of PCVID beginning at 11 weeks of age. It means these pigs repeated the same clinical image that the farm in the last months. Arriving to 10, 11 weeks of age, they developed the clinical symptoms of the disease. The clinical signs included wasting, lack response to conventional treatments, paleness, diarrhea, and increased mortality. Only a few pigs show skin lesions suggestive of porcine dermatitis and nephropathy syndrome. It means that mainly we are in the phase of PMW's case. And the gross lesions included enlarged lymph nodes, particularly the mesenteric nodes, lungs that usually failed to collapse normally and had significant interlobular edema in some cases, kidneys that were enlarged and or had multiple white spots, enteritis suggestive of ileitis, and edema of the colonic mesentery. Results. As we saw in my last presentation, no adverse reactions attributable to Ingelvac CircoFLEX were observed through the study. No swelling, no lumps, no anaphylaxia, no die pigs after the vaccination. What's happened with performance? In this table, I share with you our data our data of mortality in the nursery area. You can see here the three different groups, 3 weeks, 6 weeks, and controls. We don't find differences in the mortality in the nursery area. Controls and both vaccinated groups perform pretty similar at that level. Why? Because remember that our PCVAD cases start at week 10 and 11. It means in the finishing area. Then that means that PCVAD in this specific case is not affecting our nursery area. But what's happening in the finishing? You can observe here mortality in the finishing, almost 8% in the case of the control, and in the case of the vaccinated pigs, 1.9 in the 3 weeks vaccinate and 2.25 in the 6 weeks vaccinates. Huge differences and statistical differences in mortality. Another point, culls, 6.3 in the case of the controls versus 1.6 and 0.8 in the case of the vaccinated. Again, huge differences in reduction of culls for the vaccinated groups in comparison with the controls. Again, significant differences. What about performance? In the case of performance, we found in our final weight, that doesn't mean that its weight to the market, it was our final weight based in our trial design. 239 pounds in the case of the control, and around 16 more pounds in the case of both vaccinated groups. Then, in summary, we have reduction in mortality, reduction in the number of calls, and increase in the final weights. Another important issue. This table shows part of our sampling procedure that we did in this trial. Each pig, in an individual manner, was sampled at 3, 6, 10, 14, 18, and 22 weeks of age. In this specific case, I'm just sharing the information about viral load, or viremia, if you can name it this way. And you can see that, as I presented before, we don't have problems or viremia related in the nursery. Yeah? We start the viremia, the peak of the viremia, at 10 weeks of age. And we found significant differences between the viremia of the controls versus the vaccinated pigs. Both vaccinated groups have a significant reduction in viremia in comparison with the controls. It's a summary here. Finishing mortality, huge differences in comparison with the controls. Average daily gain, again, huge differences in favor to the vaccinated in comparison with the controls. The same for final weights. When we work about the return of the investment, it means all the benefits that I received for the vaccination procedure against my inversion, I have a return of investment of 8 to 1. It's really, really interesting data. In summary, for this part of the trial, we can say that Ingelvac CircoFLEX provides a rapid onset and long duration of protective immunity with simple 1 ml intramuscular injection. We can say that Ingelvac CircoFLEX is safe and non-reactive, that we can get reduction in mortality and improvement in performance parameters, and a consistent reduction in viral load based on this. we're going to talk about subclinical. But before to talk about subclinical, I just want to review this information. What's happening with the PCV2 infection? Usually, it starts with one oronasal transmission. This oronasal transmission gets the PCV2 infection in pigs between the 6 to 14 weeks of age. The pigs become infected, generate a PCV2 viral replication, an antigen presentation, and affect the epithelial cells. After that, we got viremia and a systemic distribution of the virus in tissues. But we have two different ways, or two different pathways. We can have one pig clinically infected with PCV2. Usually this happens because the pig has the PCV2 infection plus one specific immunostimulation. Could be the presence of another pathogen in the farm. Could be another way that has that immunostimulation. As a result of that, we're going to have a pig clinically sick, infected with PCV2, and an immunosuppression. Yeah? This is the clinical route of PCV2. But in some cases, we have PCV2 infection, and we have pigs clinically normal, but they are infected with PCV2. We have several farms in which nobody saw the clinical manifestations of the disease. But every time that we go to that farm and sample that farm, we can get seroconversion and we can get viremia in different pigs. Then, the result of this is that we can have clinical presentations, as I described this morning, could be related with delay in growth, increase in size of lymph nodes, thymus atrophy, interstitial pneumonia, ictericia associated with hepatitis, kidney with white spots, and presence of PCV2 in different tissues. Another clinical presentation is related with diarrhea. What's happening with the pigs in the case of subclinical infection? They have an absence or a significant reduction in the microscopic lesions if we don't have another important processes in place. Low amount of PCV2 in the tissues and mild lesions mainly in lymph tissues, and lesions and mortality related with other cofactors. Or well, as I presented before, a normal pig in the barn. Then, based on that description about what is clinical and what is subclinical, I try to share with you one experience in one farm that has exactly that problem. As you can see in the tables that I'm going to share with you, in this case, in this farm, the mortality was not the driver. The pigs, the people in the farm never saw pigs clinically sick related with PCV2. But our diagnostic procedure says that the pigs have seroconverted to PCV2 and the pigs were viremic to PCV2. Then we did this trial in a 3-site production system. The production system was negative for pigs and positive for mycoplasma and PCV2. The peak of PCV2 viremia occurred around 10 weeks of age without clinical expression of PCV2. The pigs were weaned at approximately 20 days of age from multiple sow herds commingled at the nursery were used as study animals. We used in this trial a total of 1,200 pigs, and we placed on test 600 vaccinated and 600 non-vaccinated. Like pens of pigs, same sex, same size, with either 25 or 50 pigs per pen, were designated as study pens. Within the study pens, every other pig was vaccinated or injected with placebo and double ear tagged, coded by treatment group and individually weighted. Vaccinated and controls were commingled within pens contained in barns where the rest of the pigs were not vaccinated. Vaccinated pigs received a single 1 ml intramuscular dose of CircoFLEX, and the control received a single 1 ml intramuscular injection of sterile water placebo. Pigs were individually weighed on the day of vaccination, day 0, on day 41, prior to being moved to the finishing barn, and again on day 131. In addition, 2 pigs, 1 vaccinated and 1 control, from half of the pens were ear tagged with a red tag, and blood samples were collected at 6, 9, 13, 17, and 20 weeks of age and submitted to the Beringer HMC Center. Indeed, in our health management center, we run serology and PCR testing, and finally, 509 vaccinated and 474 control pigs were evaluated at the slaughter plant for various carcass measures. Results: final weight in pounds, control pigs 210 pounds versus 216 pounds. The statistical differences between these two groups. It means in apparently healthy pigs, the use of the vaccination generates 6 more pounds in the vaccinated pigs. What's happened with the performance? Remember, we described that mortality was not the key driver in this trial. And you can see here the mortality in the nursery. 3% in the case of CircoFLEX, 4% in the case of the control pigs. No difference, no statistical difference. But remember, we mentioned in the description of the trial, the peak of the viremia occurs at 10 weeks of age. Then it's the same situation that the last trial that I shared with yours is not related with PCV2. What's happening with the finishing mortality rate in percentage? 3% in the case of the control, 2% in the case of the vaccinated. Numeric differences, but not a statistical difference. Why? Mortality was not the driver. The mortality is low. It's good mortality. What's happening with cool rate? A reduction of the 50% in the CircoFLEX vaccinated group. Then we got 6 more pounds, 50% in reduction of cools. And what's happening with the quality of the carcass? In this quality of carcass, as I said before, 500 pigs, vaccinated pigs versus 474 non-vaccinated pigs, we found heavier carcasses in the vaccinated, significant increase in the back fat, significant increase in the loin muscle depth without increase in the back fat. Then that means that I have bigger or heavier carcasses with a loin muscle depth and without an increase in the back fat. If I put together these parameters, weight, increasing weight, 6 pounds, the quality of the carcass, and a 50% in reduction in the culls, I can say that I can have a return on investment of 5 to 1. Then even when the pigs are not manifesting clinical symptoms of the disease, the use of the vaccination can help me to improve my performance parameters in the farm. Another point, what happens with the viremia? What happens with the viral load? You remember that the farm described, not the farm, sorry. We described in our trial the presence of the viremia at 10 weeks of age. If we compare the viremia between the controls versus the vaccinates, we can find a huge difference and significant differences in the viral load between controls and vaccinates. Finally, I want to share with you these data. These data came from experiences documented by Dr. François Cardinal, Dr. Robert Desrosiers in Quebec. They were monitoring 12,000 sows, multiple pigs flows of single or two sources. They practiced early weaning, all in all out by barn and in nursery and in the finisher. The farm was positive or is positive to PRRS, flu, mycoplasma, and APP serotypes 5 and 7. And pre-PCVAD mortality was around 4.5. Those are the experiences that Dr. Cardinal shared with us. What's happened with piglet vaccination? In this case, we have piglet vaccinated with Intervet, 2 doses, 4% of mortality, versus 11.6% of mortality in non-vaccinated pigs. Piglet vaccinated with Ingelvac CircoFLEX, 3.2% of mortality. In this case, these pigs came from not vaccinated sows. In the next part of the table, we have piglets that came from vaccinated sows, and they have mortality of 12% when they didn't vaccinate the pigs, 4.9 when they vaccinate the pigs with Intervet, and 2.9 when they vaccinate the piglets with CircoFLEX. In conclusion, with this observation from Dr. Cardinal, we can say that high number of pigs were placed relatively under the same conditions within this system. So vaccination was not effective, while piglet vaccination was very effective to reduce mortality in finisher. My other conclusion, or the other conclusion from Dr. Cardinal, is that 1 dose of Ingelvac CircoFLEX is performing at least as well as 2 doses of Intervet PCV2 vaccine. In conclusion, for all the information that I present today, we can say that Ingelvac CircoFLEX provides rapid onset and long duration of protective immunity with simple 1 ml intramuscular injection. It's safe and not reactive, and generate a reduction in mortality and improvement in performance parameters, and a consistent reduction in viral load trial by trial. This is the information that I prepare for yours. If you have any question and comment, I have received.